Hello, my name is Brian Zanghi. I am from Nestle Purina, and I'm going to be presenting today on an innovative approach to hydrating feline animals. So essentially, this research, where we want to share with you with regards to feline hydration, has to do with the research that we performed over the last several years related to water supplement as a hydration solution for cats. And during this presentation, I'm going to be sharing initially a variety of information regarding the background details and some key definitions of parameters that will be getting discussed during the research and showing you with the data. With that, I'll be going through 3 different studies where we evaluated the use of a water supplement for cats. So obviously, to get started, we know that there are a couple of different ways that we would traditionally have looked at increasing water intake for a cat, primarily with conversion to wet food, also incorporating the concept of slightly higher sodium levels in the diet to stimulate thirst. But there was this opportunity, and we feel like there was a need, particularly for cats that consume dry food, where a water supplement will come into play, and that's what has led to the launch of the Plan Hydra Care product. So initially, to get started with some key definitions, I'm going to be going through data that's referred to as liquid intake. So this refers to either plain tap water that's drank from the cat's bowl, or the nutrient-enriched water supplement, or the Hydra Care product. And that differs from what I'll be referring to as total water intake. So total water intake being the calculation of the 3 sources of water that an animal will consume or have each day. So drinking water from their bowl, their moisture from their food, as well as calculating or including the metabolic water that occurs from the metabolism of macronutrients. Now, more specifically, the total water intake also excludes any of the dry matter in the Hydra Care, the nutrient water supplement. So just for purposes of making sure that all of that data actually represents truly water intake on a body weight basis. So that leads us to the next set of definitions, where I'll be referring to specifically total water intake as it refers to milliliters of water on a per kilogram body weight basis. Typically, the literature in the past has reported this data as total milliliters per day, not taking into account body weight. But when you put on the literature that exists and looking at that, the cats that consume a dry food will typically ingest 20 to 30 milliliters of water on a per kilogram body weight basis. And then you compare that to cats when they are eating a wet food, that volume goes up to where it's about 35 milliliters per kilogram body weight. Going on to the next definition, before I go into the studies, wanted to share with you some of the nutrients that we incorporated into the water supplement to help provide the benefit of improved hydration to the cats, to help with the nutritional attributes associated with the supplement. And that includes specifically nutrients that are considered organic osmolytes. And this would include amino acids, sugar, glycerol, different nutrients that are function within the cell that are actively absorbed and are responsible for the movement of water into the cell, or in the opposite way, water out of the cell. And so specifically using organic osmolytes as opposed to electrolytes. So anytime that I'm referring to the nutrient-enriched water, we're specifically referring to nutrients that are organic osmolytes, more particular, the inclusion of glycerol and amino acids coming from the whey protein, as well as the hydrolyzed protein from the poultry. To go into the first study, just to share with you some of the key objectives of this particular study, I would say first and foremost, we wanted to evaluate how much the cats would consume if they were provided the water supplement on an ad libitum basis. This was some of our early work to assess that. And trying to understand this dynamic between where the cat's preference was with consuming the water supplement versus just having tap water alone, how their water intake changed, and then from our preliminary results, knowing that there was a high preference for this water supplement, that if we evaluated consumption over what we considered at the time a more prolonged availability of the liquid, in this particular instance 2 months, would the preliminary results that we were seeing as a high intake preference be sustained over that 2-month period? So that's some of the data that I'll be sharing with you. And then does this sustained long-term intake of the water supplement translate into, or how does it impact the urinary measures that we all associate with relative hydration, particularly in healthy cats? And this initial study was published in 2018 and is one of the 2 studies that we published in that year. So in terms of the study design, we had 9 cats that were provided the nutrient-enriched water versus 9 cats that were control cats and had tap water available to them during the entire study. We established and monitored a 1-week baseline of their water intake and their food intake. Then moving into the first week and a half of the test phase, knowing from that preliminary work that the intake of the nutrient water was very high, we felt very comfortable that by substituting the tap water for the nutrient-enriched water, that the cats would have adequate amount of water intake to at least be on par with tap water. And the additional value of this is that the food and the liquid were on an automated food measurement system. So that way, anytime the cat drank or consumed their dry food, we could know exactly how much they were eating over the course of a 24-hour period. And so obviously we had that full everyday data of food and liquid consumption. What that allows us to do is that allows us to be able to know exactly how much food moisture they're consuming, exactly how much, calculate their estimated metabolic water intake, as well as their drinking consumption, to be able to calculate that total water intake. Now, as we move into the final 6.5 weeks, the food was taken off of the automated feeding system, and so we were able to differentiate how much tap water versus nutrient water the cats were consuming. And so we could then delineate their preference there, but by not having the food on the feeding scale, that eliminated our ability to generate that total water intake value. The food was available ad libitum in a separate location, but we weren't measuring that daily intake from the cats because the cats were in this study group housed, so we couldn't get individual food intake. So to give you a quick assessment of the data, the water intake, I should say the liquid intake for the cats consuming the nutrient water was significantly higher during that 1 week, during that first week of availability of the nutrient. You can see here 148 total milliliters per day on average versus a very typical 90 milliliters of tap water consumption. So a 67% significantly higher intake with the nutrient water. Now, when you calculate that on a milliliter of liquid intake, the nutrient water intake per kilogram body weight basis, again, the tap water is very consistent with the previous historical research of water intake at 21 milliliters as compared to the nutrient water, which has now significantly increased to 33 milliliters of the nutrient water per kilogram body weight basis. And then, as I mentioned, the ability to be able to calculate total daily water intake itself as water, 25 milliliters of total water intake versus 37.5. And if you remember from that first slide where I was sharing the information on the definitions of the unit, wet food intake is typically averages around 35 milliliters per kilogram body weight basis. So this data right here shows evidence that use of a water supplement can provide a even more significant ability to have the cat consume a total water intake on a per day basis. And then how that translates into the urinary parameters, we had a very significant increase in the total urine output that the cat experienced. You can see with the tap water group, typical average of 10 milliliters per kilogram body weight per day, versus the nutrient water, where we were observing this level of higher water intake translated into this 15 milliliters per kilogram body weight of urine output. And that also relates to the fact that the cats had a more dilute urine. You can see that with a 0.040 urine specific gravity. Just briefly, the other parameters that we assessed, GFR was not different between the groups as determined with endogenous creatinine excretion rates, blood urea nitrogen, and phosphorus were all within the normal range. Now, moving on to the second study, to differentiate this trial from the first study. One, the first study was the cats were offered the liquid ad libitum. In this study, we're wanted to evaluate the water supplement provided on a very specific body weight dose basis. And in addition to that dose basis, would an increasing of that dose translate into an increased amount of liquid intake, which would then, would we see an increased level of urine dilution corresponding with that greater level of intake? Now, to assess this, the feeding durations were much shorter. For each dose period, we only allowed availability for between 10 and 17 days, depending on the period, and I'll go through those details in a second. And this study was the other one I was referring to, also published in 2018. To be a little bit more specific on this experimental design, the dosing regimen was, the cat was its own control in terms of what that particular dose was. So in week one, which is period one, again, we established a baseline for what that cat's normal tap water consumption would be. Based on that particular cat's consumption of water, if we take it as an example, that cat consumed 100 milliliters per day, then when we go to period two, which we refer to here as the 1x dose amount, what that means is that the cat would receive 100 milliliters of the nutrient-enriched water. And that would be in addition to ad libitum availability of tap water. So they would have, that's what their three bowls are. So they have their tap water, as much as they want to drink in tap water over the course of the day, the nutrient water, which in this case is 100 milliliters. Then you take that 100 milliliters, and what we did is we provided 50 milliliters in the morning, and we provided 50 milliliters in the afternoon. And they also had access to their food. Now, if we move on to period 3 and period 4, the dose goes to 1.5x. So assuming this example of 100 milliliters of water, then they get 100 milliliters period 1, they get 150 milliliters in period 2, and then in period 3, and then in period 4, they get 200 milliliters of the nutrient-enriched water. So that's the stair step with regards to the 1x, 1.5x, and 2x dose regimen. Again, the nutrient-enriched water we evaluated here is exactly the same liquid that we tested in study 1. Now, to share the data, I think this is a pretty clear indication that the more nutrient-enriched water that the cat is offered on a per dose basis, the greater total liquid intake that they consume. Now, this graph, where I really wanted to be able to show that minor day-to-day variation that we see over the course of the entire study, this data represents both the intake of the drinking of the nutrient-enriched water, as well as the tap water. So clearly we can see that the tap water group, the control group, is very stable over the course of the entire study. When we go into having that nutrient-enriched water, a higher intake of total liquid drank. Then when we go to 1.5, obviously higher, and then the 2x, we're seeing a nice increase from there. And on the right-hand side of the slide, I've provided the specific dose that was offered in terms of the different treatments. So the 1x dose would have received the equivalent, on average, this is a group average, of 26 milliliters of the nutrient-enriched water per kilogram body weight basis. And you can see how that number goes up incrementally. Now, what is important here to share is that while that first graph was total liquid intake, again, nutrient water and tap water, we felt like it was really important to indicate and to share with you how that impacted the actual tap water consumption. And so if we look at this first bar, the very big bar on the left, that's the tap water only baseline. So of course that's 100%. But now when you look at period 2, the tap water consumption makes up only 20% of the total liquid that was drank. And so then moving on to period 3, we're at about 18% in there. Period 4, it's about 17 to 16%. And really what that indicates to us is that the total liquid intake that we observed in the first graph to the left is actually truly representative of the cats consuming most of their water as the nutrient-enriched water as opposed to the tap water. In addition, secondarily, what this also indicates, and I think this is also very important, is that when the cats do not have access to the nutrient-enriched water, they will still consume their tap water over the course of the remainder of the day. Because again, they only had the nutrient-rich water for about an hour to hour and a half during the morning, and then the later portion in the afternoon for a sub period of time as well. Now, how does dose, increasing in dose of the liquid intake translates into the urinary parameters? You can clearly see that there's a significant drop in the concentration of the urine-specific gravity, going all the way down to a 0.02 in the case of period 3, where they received the 1.5 or the 2x dose. Not much additional dilution in the urine. Obviously, after we get to a point of the 1.5x. However, even though I didn't show the data here, the urine volume does continue to go up with regards to the 2x dose. So very significant ability to dilute the urine to provide that additional urinary hydration measure. Now, taking all of the dose data, this I feel like was actually one of the more compelling pieces of assimilation of all of the data coming out of this study, is that as I had reviewed the literature and we were really trying to understand this space of how we could evaluate water intake parameters and how that influenced the urine parameters in cats, this entire body of the dose influence on these values really allowed for us to establish this relationship in terms of this trajectory of where water intake and urine output parameters come into play. So with this first graph, and I think this is actually was the first time that I've seen this particular data in the literature, is how we can really start to understand the relationship between, at least in healthy cats, the urine volume output with regards to the concentration or the urine-specific gravity value. Clearly, as the volume goes up, the urine-specific gravity gets more diluted. Now, we take that urine-specific gravity, and plot it in relation to the total water ingested on a kilogram body weight basis. And you can see this nice curvilinear response that as the cat drinks more water, you get a nice relationship in terms of how that translates into the dilution of the urine. And so we've got these lines here, just arbitrarily selecting a 0.035 target for a healthy dilution in the urine for relative improved hydration, as opposed to where we would typically see cats consuming dry food, where it would really be in the 0.06 to 0.05 range. So if we take that target of 0.035 and say this is where we would potentially want to play or try to have that cat achieve that level of urine dilution, it also translates into approximately 15 milliliters of urine volume per kilogram body weight per day. And as we saw in that earlier study, that's what we were also seeing with the intake of the liquid in study 1. Now, that's what that blue line represents. And so that 15 milliliters, you can begin to start to predict and estimate, depending on the amount of water that the cat consumes per day, where their urine volume output would be in terms of being able to flush their bladder, being able to have that level of hydration, that general urine output target in terms of reducing or improving that urinary flow. And so on the bottom, we've got these different ranges. As I had mentioned, dry food typically is in that 20 to 30 milliliters of total water, specifically taking all three calculations, numbers into the calculation, compared to 35 milliliters per day with the wet food. And now what we're seeing with our particular study, this dose response study, how we can observe water intake in the range of 35 to 55 milliliters per kilogram body weight. So clearly as good and superior to converting a cat to a wet food. Now, go into the final study, just kind of wrap up where we're going with some of the research that we've done. This is a little bit of a unique study. The idea here is I really wanted to be able to see what kind of opportunity there was to demonstrate a benefit for the water supplement and for cats in particular to improve their hydration in a clinic setting. And that's where, in thinking about this opportunity, looking at this preoperative fluid evaluation, particularly as an animal comes into the clinic who's needing to go under anesthesia and wanting to make sure that they are adequately hydrated prior to that particular procedure. Whether in some instances, as you know, there are some instances where IV fluid is obviously IV fluid is obviously always necessary, but in certain instances where IV fluid is at the discretion of your procedure and the amount of time the pet is under anesthesia, how does the use of preoperative fluid compare to that situation where the pet is elected not getting IV fluids? And so that's what we'll go through with this. So the other objective was, one, will the cat consume the liquid supplement in a clinic setting? So we do evaluate that. And then how does the preoperative fluid intake affect total body water and the general assessment of hydration? And also I put cardiovascular function, but we didn't really see any difference there. So I don't actually show the data towards the end. So let me just go through this experimental design. So this was all healthy adult cats that were going to undergo a routine dental cleaning, that were going to need anesthesia. The age was 1 to 7 years old. Again, we used the same nutrient-enriched water as the previous studies. And the procedure was they were moved from their normal housing into the vet clinic several hours before they were going to have the cleaning done, primarily because we wanted to be able to offer them the nutrient water at 2 to 3 hours prior to anesthesia induction. So they have enough time to have access to the liquid, to consume it, and be able to have that time well enough prior to the procedure. In this particular study, though, all of the cats were offered 50 milliliters. It wasn't established on a body weight basis, and I'll go through and show how that impacted the actual dose on a body weight basis data. But just to be specific here, all the cats received 50 milliliters, at least that's what they were offered to consume. Now, the cats that were that underwent IV during the procedures or did not have IV fluids, they still had a catheter implanted or placed, but they were not provided fluids during the procedure. During this period, as they were coming into the clinic, they were also offered 50 milliliters of tap water. So they did have access to tap water if they wanted to drink that, and we also evaluated that particular amount of water intake. So I have some of that data to share. And then the measurement times, what we looked at here is that we evaluated their total body water and the other parameters 3 particular times. So it was at the very beginning when they were brought into the clinic, before they were offered the nutrient waters or the regular water. So we got that baseline value. And then immediately prior to anesthesia, so at that 2 to 3 hour time frame after water availability, but immediately before they went into the procedure. And then finally, immediately after the dental procedure was completed, and immediately before the reversal of the anesthesia was performed. And so again, just to reiterate, there were 3 treatment groups. There was the group that received the IV fluid administration during the anesthesia. There was the group that did not receive fluid administration during anesthesia. And then there was the nutrient water group that was provided the liquid and also did not receive IV fluid administration. So very briefly, I'll go, so this, as we start to go through the data, so the cats that were the nutrient water group, you can clearly see there was a very significantly greater amount of liquid intake. So the average, even though they were offered 50 milliliters, the average consumption was 42 milliliters. Now it ranged all the way down to 15 milliliters, all the way up to a full, they consumed everything that they had received at 50 mils. Now, as opposed to the cats, the other 2 groups of cats, you can see there was some minor intake of tap water. Most of the cats did not consume the regular tap water, but there were some cats that did ingest a little bit. So both of those groups were nearly the same in terms of their tap water consumption. And so, as I had mentioned, we had provided 50 milliliters of water to all of the cats. Now, when you look at that on a per kilogram body weight basis, you can see that the smaller cats, or I should say the larger cats, consumed a lower amount on a per kilogram body weight basis as opposed to the smaller cats that received more. So up towards the 12 to 15 mils. Then, and just to give you some data in terms of how long the cats were under anesthesia. So the nutrient water group, just so happened that there was a little bit more variability there. That did not have anything to do with the liquid intake. That was just with regards to the dental cleaning and the time spent with the cleaning of the teeth. But there was no significant difference in between the groups in terms of how long the cats were under anesthesia. And so going into, so this data represents the change from baseline. So this percent change, you can see though the blue bar on the left represents the fact that immediately before the cats went into the dental procedure and underwent anesthesia, those cats were about 0.75% increase in total body water, as opposed to the other control groups, where they were slightly below or had a slight drop in their total body water. And then moving into at the end of the procedure, and see that the cats that did not receive any IV fluids in the light gray bar had the greatest reduction in total body water, almost to a 1% decrease. Obviously, we can see that the cats that received IV fluids we were able to maintain their total body water exactly the same over the course of that short duration of anesthesia. And in fact, the cats that had received the nutrient water, you can see that went down, but at least they are at that 0% from where they were prior to starting the study. So right back to baseline. So no difference in between the nutrient water group and the cats that had the IV fluids. Now, there was a greater degree of variability in terms of the cats that received the nutrient water. And that's what I actually want to show, is that reflecting back on this data, I think that in a follow-up study, there would be a lot of value in evaluating the nutrient water dose on a specific body weight basis. And you can see here that the cats that had the lowest dose, so the bigger cats that received the lower dose on a per kilogram body weight basis, down here on the left-hand side would have experienced the lowest change in total body water. So that makes sense. On a per body weight basis, that received the lowest amount of water, so they had the lowest amount of increase, versus those smaller cats that had a larger dose on a body weight basis had a larger increase in their total body water. So that makes sense, you know, in retrospect. And I think what that does also indicate is that any sort of specific liquid therapy, as I state here in the summary point, is that the dose should be standardized to body weight relative to where we would want to try to target that increase in total body water. But ultimately, I think the main conclusion here is that the liquid therapy does prevent that natural loss that would occur in a procedure, in a short procedure where no IV fluids were used. Now, going on to this last set of data, I think this was actually also reinforces the value and where we can see the benefit to the particular cat undergoing this particular procedure. So this red line reflects what's referred to as a lean body mass. So let me go through this real briefly. So the cats, we assess total body composition with using quantitative magnetic resonance. So it's called QMR. So this procedure is where the cat remains awake. It is a couple of minutes scan and it assesses total body water, it assesses lean mass. It is an alternative to DEXA to estimate body composition. What this also does is the fact that the technology can specifically assess lean body mass, separate from total body water, separate from body fat. The body water and the lean mass calculation allow us to determine a value for this lean mass hydration constant. Now, the standard value, the coefficient that's been established in the literature is that lean mass has a water content of approximately 73.2%. So that's been demonstrated over a variety of different publications. And when we validated the use of the QMR technology in cats and dogs, we're also able to evaluate this, what's considered the standard coefficient, and found that value is close. It varies with the particular pet's body fat level. But regardless of that, that's what this value represents. It's a way of estimating how much water is associated with the lean mass, which I would qualify as a surrogate for the overall hydration status of the pet. And so when we're looking at baseline, those particular cats had, you know, this increasing level, this range. And so I put this green arrow here is that when we look at this lean mass hydration constant, the value for those particular cats is higher at pre-anesthesia and is basically the same at post-anesthesia. So we know that value, that the lean tissue in the cat has a greater proportion of water associated with it. So we would say that cat is better hydrated. Now, if we then move to this right graph, you can see that relative to baseline, on average, the cat's receiving the nutrient water at about a 0.8% increase in the lean mass hydration constant, as opposed to that's within the normal error of, I would say, the measurement of this particular parameter, at about 0.2%. Well, what's a good control verification here is that post-anesthesia, after the cats have received IV fluid, you can see that their lean mass is also better hydrated. So the obvious benefit of having IV fluid administration during the anesthesia, that the lean mass is adequately hydrated. So clearly there's an improvement from the onset of the study, or the onset of the anesthesia, through the period of when the anesthesia is completed. And then those cats that at the post portion of the procedure, again, there's a slight increase, but there's no difference between those particular groups. So that's just typical natural variation, I believe, in that particular measure. So just to summarize these points. So lean mass hydration, and we've seen this before, and this is a really important assessment, that this may actually be a good surrogate marker for this particular type of procedure to assess tissue perfusion. Now, with regards to the lean mass hydration constant, that graph on the left again shows that the value is sensitive to the dose-dependent response of the liquid that's being provided. So had these cats all been provided a similar dose on a per kilogram body weight basis, I suspect that these curves would have been more linear horizontally, and that increase in water proportion of the lean mass after drinking observed prior to induction of anesthesia and sustained. So that was the point here, is that the cats go in with their improved assessment of hydration per this lean mass hydration constant variable, and that is sustained over the course of the anesthesia period. And this was the last point that I had mentioned. We did not see any difference in blood pressure or pulse rate over the course of the study between the three groups. No difference in serum creatinine or glucose, as well as no difference in urea nitrogen. So I'll conclude by summarizing these last few points. The studies clearly indicate that liquid intake can be increased incrementally when the cats are offered a higher liquid dose. So I think that's been a very valuable learning from this, in addition to showing that the nutrient water provides greater liquid intake, which translates into a greater urine dilution for the pet. The table outlines this comparison. Again, total water intake that's typical of cats consuming dry food, 20 to 30 milliliters per day per kilogram body weight. Again, this is all three sources of water that the cat would ingest or have each day versus 35 for wet food. And the nutrient-enriched water really showing an opportunity for superiority here relative to wet food. And I think this really reinforces the value of where a water supplement can play in the feeding regimen, the hydration regimen of healthy cats, or cats that are in need of increased liquid intake for a variety of health-related reasons. There's a very significant opportunity here to deliver that benefit. And so with that, I will conclude, and I want to say thank you to everyone that listened as I walk through the research that we've performed that has now led to the delivery of the Plan Hydra Care product. If you have questions, please refer to the email below. Thank you very much. Take care.